Welcome to the ThinkFactory Podcast. We got one question for you. What keeps you up at night?
Good afternoon and welcome to the ThinkFactory. My name is Susan Kleiner and I'm the host of today's episode. Today on the ThinkFactory podcast, I'm excited to welcome Tara Good-Young. Tara is the CEO of PDI Surgery Center, a pediatric ambulatory surgery center dedicated to delivering life-changing dental care to underserved children and patients with special needs. Tara has spent more than 2 decades leading healthcare organizations across multiple specialties, from oral surgery and plastics to community health, and is known for building strong cultures, high-performing teams, and patient-first systems. She's also a nationally recognized voice on the future of ambulatory surgery centers, technology adoption, and mission-driven healthcare leadership. Tara, welcome to the ThinkFactory. I'm so glad you're here.
Susan, thank you so much for having me. Such a great opportunity. And I've gotten an opportunity to listen to your podcast. And I'm really excited to be invited to share a little bit about PDI with you and with all of our fellow listeners.
Yeah, it's a really interesting organization, and I'm so happy to have you here. So thank you. So I had no idea before talking to you about what a pediatric dental surgery center does and the community it serves. So would you mind just sharing with our listeners, what does PDI do and what sets it apart?
Absolutely. Well, as you mentioned, PDI Surgery Center, we are a nonprofit dental ambulatory surgery center, and what we do is perform full mouth dental restoration under general anesthesia. So essentially hospital dentistry, but in an outpatient setting for children and individuals with special health care needs. And since opening in 2009, we've actually cared for nearly 32,000 patients and performed educational outreach to over 100,000 families. And this is what makes us a bit unique. We're not just treating cavities. We collaborate with schools, early childhood education centers, and primary care medical providers to be able to deliver preventive education to break cycles of disease that impact a child's life and potential. Especially in partnering with those medical providers, we know that children see their medical practitioner sooner and more often than they see a dentist in their early childhood lives. And that's important because we need to get information and access available to parents because decay impacts development of children. Physical, speech, and social. When a child's in pain for months, they can't sleep, eat, or learn properly. It impacts their overall health and potentially affects the trajectory of their entire life. And you wonder, how are the numbers so high that we have treated 32,000 patients? But you'd be surprised to learn dental decay is the most common chronic preventable childhood illness. 66% of children by 3rd grade have experienced decay, and 22% of those are delayed in receiving care, sometimes not just months, but years. And as a comparison benchmark for decay, it's 5 times more likely and more common than asthma and 7 times more common than hay fever in children. Yet, we often find access for treatment and management of those for children, and yet in dental, we find that 22% have difficulty receiving care, which ends up in this delay and then really expanded cases where we're not just treating a few teeth, we're treating potentially 12 to 20 of all of those 20 childhood teeth that they have when they are under 6-7 years of age. But that's where we come in. Families are referred to us from across Northern California. 96% of those patients qualify for Medi-Cal, which is known as Medicaid in other states. And due to that state-based insurance access, for many, we are the only place they can receive this level of care. And our focus is simple to take care of them. We want to relieve pain, stop infection, restore health, and give these kids a chance to thrive again.
Yeah, I mean, it's so interesting. A couple of things that really jump out at me in hearing that. First of all, just how common it is, more than hay fever, more than asthma, and yet it's not something that we're likely to hear about. It's not what, the type of, what you're talking about and the extent of the issue is not something that I learned about before speaking with you. And it sounds to me like the care that you provide is actually life-changing for these kids, given the degree of care that they need. Would you agree?
Absolutely, because often they cannot be treated in a dental practice due to the size of their case. When you're having that many teeth that need to be worked on, think about even as an adult, how comfortable or how excited are you to go to the dentist knowing that you need to have work done? And as a small child, think about potentially trying to have to be restrained and then come back and have multiple treatments to try to do it in bite-sized case management, whereas when they get referred to PDI, it's so that it comprehensively can be done all at once under general anesthesia, so it lowers the whole stress level point. And our hope, of course, is giving these children and their families a fresh start at oral health. It also sets that child up not to be, if you will, dental anxious or dental phobic in the future, and then going on as an adult continues to seek regular preventive and treatment care at their dentist rather than being someone who's terrified of going to the dentist.
Yeah, that it sounds, so incredibly important. And I guess the other thing that I think is interesting is that you are on the forefront of education with medical providers, schools, et cetera, to hopefully, I mean, in a perfect world, we wouldn't need PDI Surgery Center, right? Or only for the rarest cases, would a child need to undergo general anesthesia to get the type of care? So you're on the forefront of the preventive side as well, correct?
That really is our hope, as we joke that we're trying really hard to put ourselves out of business by diminishing and eliminating the need. But it has been really fruitful working with the early education center. So we're hitting children and those caregivers, preschool teachers, pre-K, etc., where they've got an influence to be working with these children that are just 2 and 3 and helping them with little steps of dental hygiene practices, and then also then educating parents on care and really bringing it to a parent's attention that if there's visible decay, how important it is that they get to a dentist and get care. And our education at birthing centers has been fantastic because we're catching moms right before they're due or right after they've had their new little one. So we can talk about early infant oral hygiene and setting up really great routines that also challenge some of the old and kind of myth-based information that, oh, don't worry about baby teeth. You don't have to worry about care or seeing a dentist because baby teeth just fall out. And we, of course, all know that, that obviously is not the complete truth. Yes, while baby teeth fall out, they are the space holder for permanent teeth, but in more immediacy, that is what they use to speak, eat, socialize, smile, express themselves with. And a child that's in pain, a baby tooth does not necessarily hurt any less than a permanent tooth does, and it also is still prone to getting infection.
Yeah, so true. Well, I want to switch a little bit and talk about your background, because I know that before coming to the nonprofit space, you had experience in the corporate world. And I'd love to hear some more about that, how you made the shift, why you made the shift, how you've found the shift. Would you care to share somewhere with our audience just on that?
Yeah, absolutely. So moving into nonprofit leadership it was an important mission shift for me.
Mm.
The work often is very much the same as far as dedication and attention to detail. And I've spent more than 30 years in medical, dental, and ambulatory surgery operations, but they were mostly in the for-profit environments in my leadership years. I loved the ambitious challenges, yet I began to feel this pull to invest my leadership in delivering direct impact for families who are often voiceless in healthcare. And this was if you will, a 360 return for me, almost like a coming back home. I had started out my career in pediatrics. And at the time, this is well before ACA insurance plans. Many of the children that we took care of had metabolic and genetic diseases, also known as congenital diseases, which most common insurances at the time would not cover. So the fact that these children were born itself was a prior existing condition. Those children in that state, they were on Medicaid. And I got a great education and also satisfaction out of advocating for those families to get additional providers, specialty providers, to take Medicaid, to partner with us to create a team treatment effect, because many of these children needed a pediatric cardiologist, endocrinologist, neurologist. So getting those specialists to be willing to take Medicaid so we could 360 treat those children really was a huge satisfaction, and seeing those patients and their families relieved of not having to travel 8 to 12 hours away to go to a specialty teaching hospital. So when the opportunity came up for me to step into nonprofit, I felt like I had the chops for it, because it requires the same rigor as corporate leadership. But now you just need to do it with fewer resources and higher stakes for the community members and staff that are depending on you. So suddenly every decision really matters in a more critical way. Every dollar has to stretch. Every operational choice affects how many children get life-changing care, and ultimately the sustainability of the facility, that goal to be delivering care for years to come for patients in need. So the challenges are quite real. Got limited reimbursement, competitive wage rates to try to prevent workforce shortages or turnover. No team works very well if you've got a revolving door of staff that you never get to have a high level of performance, experience, and organizational knowledge. So there's that constant tension between that mission and sustainability. Ultimately, as one I've heard said before, is no margin, no mission. So you really are pulled into that tension. But the rewards are definitely extraordinary. In private healthcare, you measure your success predominantly in your metrics, quality, reviews. At PDI Surgery Center, these also matter because mission alone can't pay the bills. However, this is where mission really fuels the work. Our daily wins are additionally measured in the relieved pain, reducing parents' worries, and in seeing kids be healthy kids again, and knowing that they've got a reset to start their lives and the whole group as a family moving forward. And additionally, we are hoping beyond treating that child when we're educating the parents while they're in the facility with us. We are hoping that we are also reaching siblings and cousins, other family members, again, debunking those myths about when care is necessary and that baby teeth don't matter, and also making good nutritional choices that help support overall children's health and their dental health. It's a lot of strategic balancing. We are carefully considering both the financial and human impacts of every decision.
Well, you mentioned just a moment ago about how, you've taken on ambitious challenges during the course of your career. And certainly now I know that your organization is facing some ambitious challenges with regard to cuts in the dental industry. And it sounds like you need to put your advocacy skills to work, those that you've been working on for many years when working with patients. Can you just tell us a little bit about what's happening right now in the landscape and how PDI is poised to try and address the needs of the population it serves?
Yeah, it is a big challenge. And honestly, we were hoping as of last week we might have had more hopeful or lifting news from the California state budget, but we at this time are not hearing that there is going to be a difference in a line item cut for reimbursements to dental providers that are delivering care to Denti-Cal patients, as well as also reducing benefits in the general population. So we are going to potentially see fewer providers delivering care, more people that have lack of access to care, which is going to have some public health impacts. And of course, for us, it's going to have some financial sustainability impacts. And that challenge, that is our biggest challenge, is the sustainability. How do we continue providing high acuity care for the state's most vulnerable children when the financial model is really fundamentally misaligned with the cost of care? And private health care is feeling it as well. But for nonprofits, it's significantly magnified with already the lowest reimbursements for care, yet we have as high of cost to deliver that care. And California's Denti-Cal cuts have hit organizations like PDI especially hard. When 96% of your patients are on Medi-Cal, a reimbursement cut isn't a budget adjustment. It's actually an existential threat. We aren't in a position to shift our payer mix, which is much of what you could potentially do in the private sector. As a nonprofit that delivers care to the under-resourced, as the majority of children that need our level of care, they are on state assistance. These are their programs for health coverage. And the cost of providing safe anesthesia, specialized staff, and hospital-level infection control goes up every year, and reimbursements don't keep pace. Now they're proposed to cut them by 35 to 43%. Back to the reimbursement levels of 1990s. I don't know about you, but I don't see anything that still has the same cost level of 1990s. So I'm really trying to be solution-based and innovative about how we're going to bridge those gaps between today's costs and decades ago reimbursement. And unfortunately, a recent California Dental Association survey showed that these cuts do go through. 50% of the Denti-Cal providers state they will unenroll, no longer accepting Medi-Cal dental, which is going to create wider dental deserts than already exist, which will push kids into the emergency rooms for dental decay-related infections. Problem with that? ERs don't have dentists on staff. An RX for antibiotics and pain management is what will be issued with discharge instructions to seek care with a dentist, one they're really unlikely to find right away. Statistics already show, currently even before these cuts, 40% of ER patients seeking care for dental complaints return at least a second time at a national average cost of $2,437 per visit before they find dental care. These are challenging.
Yes.
Those are really challenging costs to absorb for our hospitals and patients. And especially for the hospitals, many of these visits are going to result in uncompensated care. And then for just the general population, it also increases patient wait times in already heavily burdened ERs or urgent care departments. And that's going to impact everyone, on Medi-Cal or not. There are not two lines to the emergency room, one for private insurance, one for uninsured or Medi-Cal Medicaid based. And that's why our advocacy is so important for us. It's not an option. It really is a needed strategy. And I'm frequently meeting with our state partners, legislators, and coalitions to to really push for these carve-outs and other solutions to protect access to care. Because one of the greatest concerns is we're not going to be able to walk this back. It lasts a couple of years. Dentists that leave, they are reestablished elsewhere, have their own private practices. They're not going to return to that model, especially after being burned. And then children that have permanent dental damage, if we start getting into permanent teeth, you're not going to be able to turn that around suddenly when state budgets shift. And honestly, shifting from investing in preventive and restorative dental care, it really is just a shift. You're not saving money, you're shifting the costs to the hospital side of healthcare. So someone's always going to bear it, and ultimately that cost is shifted in the human condition.
Yeah, because as you said before, there's long-term effects from this, right? From having a poor oral hygiene, it could affect a child well into their adulthood and lead to, serious medical complications as well, in addition to all of the developmental things that you said. So it sounds really difficult. So if I have a listener that's listening and they say, okay, what can I do, or where can I find out more about this? Is there information on your website?
There is information on our website. And the biggest things that I can advise, especially if you're a listener in the state of California, is reaching out to your Assembly and Senate representatives and letting them know what your view is on the impact of public health by dental cuts in the community, because these will affect everyone, whether it is a provider that does or doesn't take Medi-Cal. If you have an emergency room and urgent care or inpatient beds, they're impacted by people that can't otherwise get care. Even if you are not serving Medi-Cal patients, you're going to be challenged to get your patient that needs hospital care to have it delivered in a timely manner. We also then have less healthy communities, and we have children in our communities that don't develop as well. They're missing school. That impacts our schools' budgets. So that's where I would start, is reach out, speak your voice, written or through email, email, to let them know what your thoughts are on that and supporting them to find other solutions than that. And then, of course, as a nonprofit, you are able to support us. If you go onto our site, we do have a donate now button, and you can choose to make a one-time donation, or you can be a sustainable tooth fairy and decide to give monthly and have it as planned philanthropy, which we always appreciate. I feel that we work very hard making both our grant and donor dollars go very, very far. We're fiscally responsible. We work very well with our vendors to make sure that we're getting the highest quality products for patients at the most cost-effective prices that they can offer us, especially knowing that we are a nonprofit taking care of the most needy. Several of our vendors work very well with us, so we make sure that our funds go as far as they possibly can to make an impact for children.
I love that you call people tooth fairies. Just a quick shout out. Can you just tell us your website address?
Yeah, so to get onto us on the web, we are PDI Surgery Center.org.
Excellent. And if somebody wanted to reach out to you, they could find your information there as well, correct?
Absolutely. We have contact by phone or email listed on our website.
Excellent. So Tara, I know you've had this interesting career, and I'm curious, looking back, is there some advice that you would give to your younger self?
Yeah, especially at such a long, winding road where I felt like I took several different positions, as you had mentioned, in the healthcare industry. I would tell my younger self, trust the long game. every role, every challenging leader, and the operational fire drills will develop skill sets and wisdom that you actually will leverage in future roles. I look back now and realize everything that I learned, from scheduling to coding to billing, advocacy, dental, surgery, rural health, a piece of all of that has informed how I work with my teams today, how I view the patient experience, how I want to elevate the patient experience. And then with that, just knowing that career trajectories aren't linear. Zigzagging to grow by making or taking new opportunities is more the norm than we give it credit for. And check in with yourself that you're making personal or professional progress that you're satisfied with during those zigzags. And I qualify being satisfied with. Don't let yourself be satisfied too easily. Make sure to stay challenged. And then finally, I'd say speak up. Don't be afraid to challenge established assumptions. Women in healthcare leadership can still feel pressured to be agreeable, make people comfortable. I say stay curious. Ask questions about how or why your organization or a process is a particular way. Making others comfortable and making an impact don't always live in the same space.
That's great advice, to trusting the long game and the zigzagging. And you're right. Everything that we learn along the way helps serve us and shape who we are today. In hindsight, we can see that, but sometimes in the moment, it's hard to see. So that's good advice. I know that you said that you've listened to other ThinkFactory episodes, and so you know that we like to ask all of our guests, what keeps you up at night?
Yes, I was prepared for that question.
Excellent.
And I had to trim it because there's so many things that sometimes want to keep me up at night. But I'll focus on kind of my top 3 to 4 in there. What keeps me up is I have my worries, or at least chewing through thoughts about technology, sustainability, and of course, public health, human impacts. How do I ensure we continue to serve about 1,900 children a year with rising cost and reimbursement dips? I worry about families challenged with access, children's health now and their future opportunities. I'm very aware statistics show that if a person has visibly missing or damaged teeth, depending on the employment rates and opportunities where they live, they can be 4 to 15 times less likely to maintain sustainable employment, potentially trapping them in a cycle of poverty and state benefit insurance dependence. Because where do most people get and have affordable insurance through? Their employer. So if you're pulling in and out of jobs, where do you have that sustainable, reliable coverage for yourself to then maintain health care for yourself and your children? And then if we don't, we can find that this cycle in families repeat itself by especially children having no agency to decide about their health care in their early youth, that this legacy goes on with them with nothing that they can really leverage against it. So we need to be the voice for their voicelessness, to speak up and see their needs. And at the end of the day, I look at this as both an economic and public health issue. When you underfund pediatric dental care, you pay for it later in ER visits, the missed school days, long-term health, and economic complications. I also think about when and where AI will be useful in our facility. We know it's a big topic these days, both in general life, corporate, and in healthcare. And I see that it has benefits, but also challenges. And when and how will it be right for our patients? I want to ensure that it fits to improve the patient experience and job satisfaction for our team, not one at the cost of the other. but I also stay up thinking about solutions, not just the worries. Partnerships, advocacy, who can we collaborate with? Workforce development, keeping my team strong, high functioning, and new models of care. How can we expand? How do we work with others to make sure in these challenging times of care that we are supporting each other to make sure that these vulnerable populations are seen, and that maybe we, deliver some innovative processes to be able to make sure that we bridge the gaps for them until this tide turns. I want to make sure that we could use technology that makes a positive impact in that, whether it's communications, tracking, making sure people get questions answered. And more important than ever, I think it's going to be knowing how to maintain preventive health and as much as possible as they can, including their home hygiene. Because what else can you do in the absence of getting to access to care is at least know how to take care of yourself to reduce your risk. So these are the things that keep me going, knowing that every day we open our doors, a family's life gets better, a child's life gets a chance for a health restart. That's what drives me, even on the hard nights.
Well, it sounds like it. I mean, and the far-reaching effects. I know I, for one, will sleep a little bit better knowing that, you're on top of it and trying to work hard to make sure that this public health issue is being addressed. I want to thank you so much, Tara, for being a guest on this episode. It's just been fascinating to learn more about pediatric surgery and ambulatory care. Thank you so much for coming.
Susan, thank you for having me. I really appreciate you and appreciate the time and interest of all of our shared listeners.
Thank you so much. So be sure to check out our other ThinkFactory podcasts, including our wellness series, so you can hear more from people like Tara Good-Young, experts in their field on important issues affecting us today. Thank you for listening.